Hello everyone, hope you all are doing well and welcome back to this Materia Medica marathon which we are doing for Boger Synoptic Key. Thank you so much first of all for the last time's response. It was amazing. I never expected this to happen. So many people were there online. So many people have shared with each other. So many people have made sure that they have seen this. So we have more than we have around 4,500 views on that video. So I am truly thankful to all of you for being there, for being so supportive, for being so motivative. Thank you so much once again. And today let us start with our alphabet B. I am going to invite my fellow runner, my very good friend Dr Vansh Luniya. He's from Aurangabad. He's done his MD from Palghar College, ML Dhawale Memorial College, which is very popular. So he's quite popular amongst a lot of students, and he has also very sound knowledge about all these remedies. So good evening once again to everybody who is joining in. Good evening everybody. And today it is not going to be a very long session, but a very quick session. We have only B is a small alphabet and we will soon be finishing. Last time it went up to 1 hour, but still you all were all there with me. Thank you so much again. And I'm inviting my
Hello.
Hello
Hi Abhishek
Vansh.
bhai.
Hello. How are you? कैसे हो भाई?
I'm fine. How are you doing? Bro? How are you doing,
So,
brother? Great.
yes, great. Once, thank you so much for joining. Let us start today's marathon. Let us start quickly running. It's a short run today. We don't have to do much. But
Okay.
जैसे opening
Great.
batsman हमेशा मैं non striker रहते हूँ. आप शुरू करो. First is Badiaga.
First is Badiaga. Okay. So as we all know, Badiaga in clinical practice, typically you can, this observatory symptom, whenever the patient coughs, the cough is so forceful that the literally people in the house, they keep scolding the kid or the patient ki ye sab the saliva is splurting out and the expectoration is flying. That is the first observatory symptom which is very useful about Badiaga. There is a clinical tip which I have about Badiaga, is that when there is heel pain, especially right side, and least pressure aggravates, right? When antiprud has failed, Hecla lava has failed, but specifically right-sided heel pain, which least pressure the patient cannot tolerate, Badiaga helps wonderfully. मतलब 3 4 5 रेमडीज फेल होने के बाद में, that kind of thing. Yeah.
Okay. Somebody is writing not audible.
So,
Everybody, can
not
everybody hear
audible.
us? I hope we are audible.
Am I audible? Yeah. Am I audible?
Just
Please,
put a
someone.
thumbs up so we know that. Okay. So just about Badiaga, one thing I'd like to Badiaga. Badiaga is a wonderful remedy where there is pain in lower limbs and descending aggravates. So usually when the patient, this is a very classical symptom where I had never seen this, but once actually a patient came and then on detailed questioning, he said, when I'm climbing down the stairs, that's when the pain is more. And wonderfully, Badiaga took care of it, and the patient was relieved in no time. And also it's a very good remedy for dandruff.
Yeah, for dandruff, right.
Okay, so let's go to next remedy. It's a favorite remedy for fever. Now, recently we were all discussing in my clinic something called as near specifics. Now, we all are very familiar about that. We all use it. We might not say it in public, but we all say that whenever you have a clinic in your clinical practice, you will have this near specifics. When you have fevers, when you have high grade fevers, 103, 104, 105 running in brain, it starts creating that delirium. It starts creating that sensation. Definitely,
Right.
there is nothing else but you can think of Baptisia. Baptisia, the first line, that the first word which Boger mentioned is soreness. Soreness is so important for
Soreness. Right.
soreness. The patient, whenever he lies down in whatever position he's going to lie down, it is going to be very difficult for him to be stagnant in that position. He keeps changing his position. You might in a lot of text you will find that this is a very it's a typhoid picture.
Mm-hmm.
When I went through a lot of authors, and the typhoid picture was actually written because it is a very good remedy for Peyer's patch. When a typhoid fever keeps advancing till the 3rd week, there is an inflammation in intestine
Right.
which leads to the Peyer's patch, and for that condition it is so close. Otherwise, you use it in any fever, dengue, malaria, chikungunya, COVID. You want to use it, you name the fever, and in almost all the cases, and especially the tongue is very peculiar. Baptisia's tongue is very peculiar, and Baptisia's offensiveness is very peculiar. That's where all these things, that's where it will fall down in this. And it's true.
I simply cut it. बोलिए.
Yeah, just last thing was that uska stool. जो last time
Right.
opium के बारे में बात किया था, सिंकोना के बारे में बात किया था.
Same. I was coming to the same point. For me, understanding Baptisia is like, yes, for me, Baptisia is like a whole of the opium mental picture with that fever and the soreness of arnica. Exactly. That's simple to understand with lot of offensiveness everywhere.
Exactly. That's
right.
Next is Baryta carb.
So next, Baryta carb के बारे में क्या बोले? Baryta carb is one of those medicines which is useful when there is weakness of sphincter in old people. You know, causticum has failed, Elos has failed, wo time pe, one of the medicines. And secondly, I do remember having old fellow who constantly used to have this vague symptoms. कि कहीं पे बर्निंग हो रहा है, कहीं पे इचिंग हो रहा है, कहीं पे नमनेस हो रहा है, which is all non-specific. मतलब B12 करा के देखो सब fine है, there is no other nutritional issues or nothing specific to label as diagnosis. Baryta carb took care of it. So non-specific burning, itching, numbness, all this sort of formication, odd sensations, especially in old people, but they're localized. You cannot label it with anything. So that is one thing about Baryta carb. One of the uses I do with Baryta carb is alopecia cases. So constitutional चालू है, local medicine चालू है, small medicines are going on. As an intercurrent, I use Baryta carb. If patient is thoroughly hot, then selenium. अगर नहीं तो then I use Baryta. It gives good results.
So Baryta, basically Baryta is at extreme of age group. या तो आपको बचपन में काम आएगा, या तो आपको old age में काम आएगा. In between, it is very difficult to find cases of Baryta carb. In जो बचपन में जो stupidity, बचपन में जो delayed milestones है, वो old age में Alzheimer's के जैसा मिलेगा आपको. Old age में you will find it in lot because of lot of you will find there is a lot of glandular involvement also involved in this. So you will find it in old age thyroid cases, old age tumor, maybe in sometimes in tumors of glandular thyroid swellings, testicular swellings, mammary swellings. So all these things in extremes of age group, basically all that I can think of is Baryta carb in extremes of age group.
Exactly.
So next remedy is Belladonna. So Belladonna is such a huge remedy that you see that it will start working on your physical level, from your on your psychology. Definitely it has a huge role in psychological symptoms and psychological cases, and it has cases in nervous complaints, in where nerves are involved. And definitely in a lot of cases of fever, you might feel in acute stages. We all know that it is first stage of fever, first stage of inflammation, primary redness, and all that is important. Throbbing is important, redness is important. All that happens, and that's where the Belladonna comes in. But Belladonna usually, apart from all these acute fevers, and if we go apart from all that topic, what you should actually think about is deeper cases of psychiatry. Lot of psychiatric cases where if you start using it in LM potencies, LM1, LM2, you start and you'll see wonderful results coming out with Belladonna in anxiety neurosis, where the patient has extreme cases of fears and phobias and all these things.
there is nothing that can match, I guess, Belladonna in cases of that. And in that case, especially, there is a lot of correlation with doctrine of signature.
Right.
Yeah.
So the family thing with all the Belladonna, hyoscyamus taken together, and many a times in most of the psychiatric cases where there is this anxiety neurosis involved, where there is unknown fears and all, many a times something of the three will come up, and in LM potencies it works wonderful. I do have certain psychiatric cases in which, when there is a phase comes wherein the patient starts to experience something weird, something unusual, and when you try to look through the ICD manual, try to correlate how it goes with the diagnosis, and it happens that constitutional medicine doesn't help there, it doesn't hold. What I'm few doses, I do have cases where hyoscyamus and Belladonna I have used as a for a phasic
for a small
thing.
phase,
It works wonderfully.
it really
It works wonderfully.
takes you through that patch of the case.
And these are the situations which keeps your patient held to your treatment for a better, longer period of time. Because at the time of crisis, the constitutional is not helping, and if you are rigid with that, you will definitely lose the patient. But if the patient's relatives are complaining about this is happening, this person is getting violent, it does happen. So I usually do this thing. If I get any past history, I'm taking 2 more minutes. During the case, if I get a certain phasic situations, कि अब 6 महीने पहले ये हुआ था, तब ये situation था, फिर 2-3 बार, so what I do, I make a small totality of that events, and I try to find out कि वो duration में क्या आ सकता है. And with the regular medicine, I give 2 or 4 SOS. दो में SL रहता है, 2 में near specific medicine रहता है. So that medicines which will come in the crisis ना, वो SOS में दे के रख देता हूँ. मैं बोलता हूँ, फोन करेगा, 1 नंबर में से Belladonna रहेगा, I know what is there in it. So Baba, ye lo, it will help. So it saves the time. I do that in practice. It helps a lot.
Yes.
Yeah.
The next remedy is Bellis Perenis.
Bellis Perenis. Bellis Perenis about, okay. Same thing. Old age patients wherein they complain of lot of ecchymosis, lot of ecchymosis patches, unexplained bruised feeling, मतलब उनको याद भी नहीं आता है कब से, all those things we know, chronic of arnica, deeper arnica, all of that sort.
Deeper arnica.
I remember having one bachchu who used to have this violent purging vomitings whenever he used to consume apples. पहले का 3-4 sittings I didn't understood what was actually happening and what it was causing, what was causing that vomiting. But for other complaints, I guess phosphorus or silica something took care. But this thing was there कि उसको craving भी था apples का, I gave veratrum, mellows, वो ठीक है. But if the mother was like कि उसको इतना apples पसंद है, खाता है vomit करता है, खाता है vomit करता है. Bellis Perenis is a medicine, it's a single medicine in Materia, wherein there is vomiting after apples. I had to take it to 200 1 mg repeated doses. I had to give it settled later on. So
just about
unusual prescription about it.
Bellis Perenis, I guess today morning or yesterday morning, Saptarishi Banerjee, Dr. Saptarishi Banerjee from Calcutta has uploaded the small explanation, and it's a very wonderful explanation. He's very sound, and I just love him for that. Clinically, he correlates to this. He says spine में अगर deeper pains है, तो nerve involvement है, and nerve involvement है, तो Bellis Perenis है. So that's a very wonderful explanation that he has given. If people have not seen, people should just go there and see that वो कल आजकल का ही uploaded है. So it's a very
it saves your day.
Yeah. It's deep trauma is like we all know it's a very it's a wonderful remedy for deeper traumas. So next remedy is benzoic acid. Now benzoic acid, usually I never knew this remedy until I actually understood the line that it is rheumatism with urinary complaints. Now we always think urinary complaints means UTI. UTI, the first thing that comes to my mind of all of us is UTI. But actually, even if the patient will come, when I broadened my vision with urinary complaints, you can take anything as a urinary complaint. You take urine leakage or incontinence, also urinary complaint. You'll see a lot of geriatric patients coming to you, and they'll say, I have this and that. And then if you say, खांसी किया तो urine leak हो जाता है, sneeze किया urine leak हो जाता है. If they say yes, Give benzoic acid and you'll get wonderful results. Like geriatric cases may this OA ka and all the rheumatic cases, this is I think the bread and butter of all the patients, all the doctors, all the homeopaths. We all feel that if they will, because they are going to keep coming to you. They will keep coming to you. They will keep taking the medicines. They're not going to go away. So that keeps giving you your bread and butter. So if you get good results in this case, so benzoic acid is one of those remedies where Jitesh Bhai is writing gout, offensive urine and motion and warm ML. So it's a wonderful combination of all these things. And also mother tincture I used when there is urinary calculi in bladder.
Right.
So it's a very good remedy, deeper acting, short result remedy.
Yes. So since this was decided, no, कि I had to prepare these things. So I was going through my pehle ke notes, which I have assisted different doctors, and I found one. I recollect one case also, and I found a clinical tip also from one of my early teachers, Dr. Manoj Nagari. He's the senior most practitioner in Aurangabad यहाँ पे. So I remember him using this benzoic acid in a very unusual way. There was a lady having cluster headaches and all of those things. He was inquiring. He has this very keen eye of catching one peculiar thing. He'll ask one questions in different ways and everything. He found a very unusual thing कि the patient used to have headache as soon as they uncovered the body. So the sir was asking कि वो headache होता है तब तुम क्या करते है, कैसा position में था? तो patient was always saying कि मैं cover करके. He was like inquiring कि fever है, chill है, क्या है, unresolved कुछ है, nothing. So he found this whenever the lady used to uncover, usually it was a night time headache and all those things. Whole detail was taken. So this was found. Uncovering aggravates the headache. It's very unusual. हर बार नहीं मिलेगा, but something to be vouched for.
Yes. Next is Berberis Vulgaris. The world knows about this.
Yeah.
You will get patients who come with this. I am taking this mother tincture, urine is stone ke liye helpful. I still don't take it. Let's start Berberis Vulgaris.
Yeah. Berberis Vulgaris. I'll tell a case example where I use this. Again, I have a lot of geriatric patients. This old age fellow came to me around 68 or 69 something age था. 3 महीने पहले की बात है. He was having a lot of hard indurations around the genitals, and we made him do the tests and all. So I sent the patient to a doctor, whoever can give a right opinion, and it was nothing. उनका ऐसा था कि old age related वगैरह ही है. What was found was there are hard indurations, hard nodules around the genitals, and second thing, high uric acid. Last thing, heel pains. खत्म हो गया. So Berberis Vulgaris I started with 200 infrequent doses. बाद में 1 mg few doses I gave. It helped him wonderfully. It resolved the hard nodules which were there around. So what was my clinical understanding was कि uric acid deposits we usually know the locations, but this location I couldn't think of them. Later on I cross checked तो मेरे को मर्फी के अंदर ये चीज मिला था. मर्फी में मिला था, right? So unusual use of that Berberis Vulgaris. Heel pain with high uric acid with this thing was found, but the location was genitals, which was surprising.
Berberis Vulgaris, what we have learned here from Dr. Master is he's using very extensively for rheumatic complaints, which are usually coming up with urinary complaints or past history of urinary calculi, and is usually tending towards the left side of the body more. And the best outcome is coming with 3x potencies. You start using 3x potencies of 3x potencies of Berberis Vulgaris, and you will see wonderful results. Like we've seen Sir teaching us, then we've seen it in Sir's clinic, and then we practiced in it, and we've seen it as a very good remedy that comes up. Also, a lot of places, a lot of references, you will find it about in cases of eczema also, where there is circumscribed, there is a circular spot of eczema and not budging, and if you get urinary all these calculi and all this, and it's more on the left side, try it as an intercurrent. Definitely, like we mentioned in Belladonna, it clears the patch. This will also help you to clear the patch. So maybe a
Right.
lot of times you have missed out. And also Berberis Vulgaris is quite popular with wandering pains, pain yahan se wahan se wahan. Like we had
Yes,
discussed,
yes, yes, exactly.
like not in exactly in abrotanum what we had seen, but this is little different from that. This is more of flatulent origin. This pains
Yes.
are more of
Usually when we
flatulent
think of
origin.
colophyllum and all those kind of remedies where there is
Yes,
shifting, shooting pains here and there, we can think of this thing also.
yes,
Boric writes, the very first thing in the paragraph is that there are a lot of shifting pains of different characters and different
yes,
sensations.
yes.
He mentions like that. Right.
So
Right.
let's take
So,
and Boger has mentioned in the last line, if you can read, the cold single parts that you will
whole single
only find
parts.
it on examination. So try it in all these things. With try and examine the patients. I've confirmed. Even I have seen in few cases where it was single part, maybe single palm. This only one palm is cold, not the other palm is cold. So single part coldness
Right.
also is definitely something which you can confirm. So next is
Hmm.
Bismuth. So Bismuth, again a very localized remedy, maybe not a very broader remedy with a lot of aspects, but a remedy which gives wonderful result. It doesn't fail to relieve your stomach symptoms, your digestive symptoms when there is excessive vomiting that we all know of. And also the concomitant that is given along with this remedy is the palms are dry. That is one concomitant.
Palms are.
And now palms are dry is written and is something which you can confirm also. These two things, a lot of times we read a lot of things, but we can't confirm them in our practice. But as soon as the food reaches the stomach, the patient vomits. Yes, Dr. Ashish Jain, this is what happens.
Right. I would like to add one thing to that. If there are dry palms, bismuth for sure. But if there are dry hot palms, then Dr. Sarka uses it as in oleum jaquecus as a confirmatory symptom many times.
Yeah.
Comes very close. One more thing I would like to add about bismuth is patients with nodules in the mammy and all in the breast. Whenever they complain of unbearable tearing, cutting pains, no, I've used bismuth two, 3 times. I had this chance of using bismuth. After using 1 or 2 remedies when they failed tapka bath, bismuth really helped.
Okay.
But the pain should be unbearable.
Definitely. I'll also try this. Borax.
Borax. Another very common remedy. Everyone knows about the mouth thrusts and downward motion aggravation. उसके साथ में all the mucous membrane affections. But about we always take our attention to asafoetida when it comes to hysterical eructations. Last time we discussion हुआ था.
Yes.
But when it's on the painful parts, then it's borax.
Yes.
So many times the patient says कि हाँ ऐसा किया, there is eructation, we jump to asafoetida. नहीं. But 2-3 times I also got this thing wrong. But when I actually examined कि भाई exactly जो part पे pain है, then it's borax. Nothing else will help, because I really had good results. And I remember the patients who were really troubled with this complaint for a very long time, like for frequent repetitions, 30 potency, long time, it really helped. And one more thing about borax, I recollect from one of my sirs. He uses this in cases of IBS, typically IBS with mouth thrusts. Mouth thrusts आपको commonly वैसे मिलता है, but in IBS cases with mouth thrusts.
Okay.
Borax.
Okay, so I think major things you have covered. What I am using is mostly only for Baptist ulcers, so I don't have anything addition to say on that. But let's go to the next remedy, Bovista. Bovista, again, these days, Bovista, the use of Bovista has increased. I think in my practice, I've seen it to be increasing. In Boger's, the first line that he mentions is hemorrhagic herpetic diathesis. Now, hemorrhagic herpetic diathesis is it covers a big spectrum, and what I'm using it is specifically when you get urticaria like rash after using cosmetics, Bovista
Right.
is a sure shot remedy. Recently, yesterday I had a case. The mother was trying to show that my child gets a rash here. As soon as she moved the finger, the rash developed. So that impressions come up immediately after they are compressed, or anything that you compress, and then immediately it comes up. Bovista. They apply this
Right.
hair. They come with apply with hair color. I had applied yesterday hair color, and today all this is swelling up, and my eyes are burning, and my head is burning, and there are a lot of wheels around. Abuse of cosmetics.
Right.
Nothing better than Bovista. I think you can go higher and higher potencies, but this Bovista will never let you down for this.
Right. Exactly. One more thing, one clinical thing about this is there's a very senior MD medicine physician, Dr. P.I. over here. He's an allopath. He taught me this thing. Whenever you get patient with history of allergies and everything, no, he does this poke test with the patient. He checks how much time it takes, and he puts a timer. कि कितना देर लगा for the red streaks to appear. The earlier or the faster they appear, he'll advise to go and do a CBC check, and he'll see if it's there, eosinophilia is there, any history of allergy is there. So in my clinical practice also, बहुत बार this happens. Higher eosin levels are there, or IG levels are high, I use Bovista. Other things should also match,
yes.
But based on the reports, it does help.
Yes. Again, Bovista is also a very important remedy for leukorrhea. So the characteristic symptoms of Bovista are not to be forgotten. So that is also something which we all will find it in our clinical practice. Next is Bromium.
Right.
So Bromium again,
Bromium.
A remedy of larynx, where your larynx, heart, circulation. So basically, what he writes is scrofulous bonds. Scrofulous blondes. Now, scrofulous bonds. You will find this remedy in cough. A lot of times when you have laryngeal cough, when the patient is not responding to any other with a laryngeal cough, this remedy will definitely give, where there's deep hoarseness. You find that the patient's hoarseness is constantly remaining. Yes, definitely, along with thyroid complaints, again, because the remedy is again of a remedy of glandular, which has a very scrofulous remedy. So again, a lot of glands will be affected. Again, my very somebody whom I keep following his textbook, Dr. S.P. Kopikar sir. If you read the book of Dr. S.P. Kopikar sir for weight loss, this is my favorite book. Every time I tell everybody that everybody who is going to start his practice should read this and start. So he mentions iodium 6E and bromium 6E for weight loss. Now you get a lot of patients in your practice who will constantly tell you that weight loss ke liye kuch hai kya. If you don't want to follow that, I have never used it. Honestly, I've never seen any results. This is what sir writes, that iodium 6E and bromium 6E. So this is giving wonderful results according to Dr. S.P. Kopikar sir. But absolutely a wonderful remedy for asthma. Asthma, again, which is a lot of people have written down that also, sailors asthma, that comes when you go on seashores, when you're on offshore, when you're going on cruise. So all these cases, or maybe even the season when there is a lot of dampness around you. When there is a lot of dampness, there's somebody's house is having leakage problems, and there's too much of rain around, there's too much floods around. Okay.
So we can see.
Yeah. No. Just
so okay. About Bromium, I was about to add this thing. Many a times it happens, there are patients who are having chronic cough or chronic bronchitis running for weeks together. After these bronchitis and laryngeal complaints are settled, there is this unusual complaint which patient says that there is constricted feeling around the neck. It is I had this multiple times with the patients. और acutes अगर आप deal करते हो और rural area वगैरह देखते हो तो we usually think of lachesis, फिर lag def, फिर Merck IRIF depending upon the side. We check there is nothing, then go somewhere to Baryta. Bromium helps a lot when The laryngeal complaints are settled, but there is a unusual constricting feeling which is left around the neck, and it is not of lachesis. It's not of the lachesis thing. And second thing, subclinical hypothyroidism wherein you get all spongia like picture is there, but the expected you examine everything and you find nothing, but the patient says itna constrict ho raha hai, itna constrict ho raha hai. Something coming very similar, very close to spongia is Bromium.
Yes,
Does helps a lot.
So Arga is Dr. Arga from Calcutta is writing, Dada, according to you and your any good medicine for weight loss? Nahi, Arga, I would have lost weight if I would have known about that. And Daivat Upadhyay is given lung fibrosis. Lung fibrosis, definitely yes. Lung fibrosis, it is a very good remedy. But I think a better remedy than that would be beryllium metallicum, because in a lot of cases.
Another one.
Yes.
Stanamide after all the of fibrosis.
Yes, dry hot palms, we were talking Dhruvi, we were talking about dry hot palms and bismuth. Okay, let's go to the next remedy. Bryonia. Bryonia,
all time favorite sabka.
Again, Bryonia, all-time favorite sabka. Bryonia is dryonia, mucous membrane dry, extreme thirst. Then there is lot of there is in the bone joint synovial membrane is reducing. All that is important, but this is all what the most important line. Like I remember, I have just only once I have met LM Khan sir, and he actually mentioned this to me, saying that always remember that you should read first 2 to 3 lines important, and when you read the first line of this remedy, it will strike to you that such an important remedy, that slowly advancing forcible processes localizing in unyielding tissues. Now
unyielding
this tissues is so self-explanatory that now osteoarthritis, if you are getting results in osteoarthritis, it is a slow process. It is slowly advancing. Right. And again, lot of things, maybe in a lot of cases where it has given good results is leukoplakia also, where there was excessive dryness in mouth post cigarette smoking, post tobacco chewing. Definitely, there are definitely other remedies, but again, all modalities matching to bryonia, where there is again slightest motion aggravation is given. So bryonia, where there is excessive dryness, you will confirm that these things, what lines these people, like what Boger, what is mentioned in Boger Synoptic Key is so true. These lines are what is to be understood. Exactly. Again, I think there is nothing in bryonia which we all don't know. There is the pain, the level of pain can be actually matched with belladonna, but belladonna is more because of fear of that. Maybe I will lose my organs, I'll fall more sick. There is more of fear kind of an element. But here, there is actual organic organ related pain. In bryonia, everything is actual organ damage happening. That is what is causing. But this organ damage has been a very gradual process, which our friend Dr. Atul Mahajan is mentioning. Thank you, Atul Bhai.
Gradual, right. About bryonia, I want to mention 2-3 things from clinical point of view.
Yes.
Where it's seen that there is sacralization in the vertebrae, or there is a stage of frozen shoulders with unbearable tearing pains. The unbearableness should be there. So along with whatever required medicines, maybe local medicines, it can be Gettysburg water or Harpagophytum, whatever. उसके साथ में Berberis Vulgaris mother tincture helps wonderfully. Not in 30, not in 200. नहीं रहेगा mother tincture, तो I have 6C. Sometimes I use 6C also. But to relieve that localized tearing pains, so the patient literally shrieks and cries. Mother tincture, mother tincture bryonia, it helps a lot. Yeah.
So next is Bufo. You start.
Bufo. About Bufo, I want to share one experience with my teacher, Dr. Nagori sir. He had this patient who had this obstructed calculi at PU junction, and it was not advancing further, and it was causing hydronephrosis. And he was a voracious reader. He did this was he gave 4 or 6 doses of Bufo 200, and the patient actually passed the stone in the morning. And he had this obstructed calculi, I guess so, since more than 1 or 2 days with all the lingering pains and everything. Bufo helped him. So his clinical tip was after that I see him use this multiple times, when specifically at PU junction when the stone gets obstructed, wo time पे at that location. It's a location specific tip. But मेरे को एक बार I had this chance of using this, but it came down in the bladder. It didn't came out, but it really helped. It saves the day again.
Yeah, just going back a little bit, Atul bhai is writing dry emotionally. Yes, Atul bhai, I would agree to it that the dryness of Bryonia might also be seen on emotional level, where a lot of people, those who have written about the psychology part of the Bryonia, that it is more of related to family and business and all these things, so that a lot of responsibilities coming up may end up one day to the dryness of emotions. So coming back to the Bufo, रंजन दादा नमस्ते. रंजन दादा आ गए हमारे बीच.
क्या बात है, रंजन दादा आ गए.
Yes. So Bufo,
I am nervous now.
अभी कोई कुछ नहीं बोलेगा. Okay, so Bufo, I think Bufo is one remedy. Maybe we all from our college days and whatever we have learned know is exactly what is the first word in Boger Synoptic Key is obese. We all have the habit of saying that somebody in the classroom, somebody in the college, and naming him as Bufo because he might be obese, because he might be a little bit nymphomaniac, because he might be a little bit of stunted and this typical truncal obesity which is mentioned. So, but lot of deeper aspects, I guess Bufo as one remedy which is wonderful in convulsions, in epileptic convulsions, in preventing convulsions, in cancer, specifically in cancer of uterus, in cancer of breast. Those who are well versed with handling cancer patients must be using Bufo quite frequently, because Bufo as a remedy in cancer has found its success very beautifully, because you will find people who were obese initially had females developing breast cancer, uterine cancer. So, and all this is topped with its psychology also. So if you read, there is a lot of idiocy, there is a lot of stupidity involved in this, but this stupidity is compensated by sexual desires.
Sexual
desires. Like in Baryta, you won't see so much of sexual desires along with stupidity, but in Bufo again there is excessive stupidity along with high sexual desire. So अगर कोई बच्चा आसपास में है तो उसको तो मारने का ही मन करेगा, कि एक तो तेरा दिमाग काम नहीं करता, ऊपर से तू पूरा दिन पॉर्न देखते रहता है.
I actually want to add to this. I really had this patient in my clinic who was having recurrent tonsillar complaints and all. 16-year-old ladka, typically Baryta wala picture and everything. And this thing happened. They came to me 3 times, 4 times, 5 times. The patient always used to be accompanied with the mother. And mother was like, now you are better, you're not getting these throat complaints and all, why to continue? He was like, I want to talk to sir and all, whatever. So the one day it happened, the mother was very much, keeping an eye on the kid. Is tarah se. So one day he managed to come with the father. He was sitting with me, talking with me, and he was having these weird ideas about exploring his own body. And around 16 years of age, knowing he was of a Baryta background, and what he started talking that day, I was wondering, are Baryta nahi hai? It strikes to us. There are situations where the patient wants to convey you things, but they cannot. So he actually wanted to come to me for his this habit of masturbating, which he found was very guilty of. So I actually wanted to put him on Oreganum majorana. I was not having it. I ordered it. बोला तब तक के लिए I'll start him with Bufo. So I had 200 at that time. I started him with it. By the time he came for second or third follow-up, अकेले में बात कर रहा था, he was like much better. बोला ये मेडिसिन आ गया है, इसका क्या करूं, you know. That was a good funny situation, but it really helped him. And later on, just to cross check things, I inquired about any past history of convulsions and all. तो वो सब तो नहीं मिला, but the mother gave a history कि when she was pregnant with the patient, that time she used to have convulsions. So it clicked like that.
Definitely a wonderful remedy with absolutely remedies. Dhruvi madam, आप ध्यान नहीं दे रहे हो क्या? Again you are getting lost. This we are talking about Bufo. Okay, so last remedy we are okay.
Thalapsi
So
Bursa Pastoris.
Bursa Pastoris, here it's mentioned in Bursa Pastoris. Otherwise, the full name is Thalapsi Bursa Pastoris. Thalapsi Bursa, obviously a very good remedy for uterine hemorrhages, pains from eyes up to head in the neck, which go upwards. But the most important remedy, most important indication, where we all know that we all use it for a lot of post-hemorrhagic menorrhagia, definitely a lot of complaints related to menorrhagia, but something which actually was highlighted by Sarkar sir when we went to his clinic was, he made us read the last line of Thalapsi Bursa Pastoris, the first paragraph of Journals in Borax Materia Medica, and he said, you read it, that effects of suppressed uterine disease. आज के time में what is suppressed uterine disease is hysterectomy. So hysterectomy के बाद lot of dramatic complaints, start using Thalapsi,
multiple DNCs as well.
Multiple DNCs. So this is actually where clinical correlation happens, where you actually see a lot of things coming up, and as a very characteristic, as buttermilk desire comes up, buttermilk desire, maybe even if the patient is not Gujarati, the patient will will ask for buttermilk. Otherwise, अगर गुजराती है तो थोड़ा सा common symptom हो जाएगा. हम लोग usually
हो जाता है, छोड़ना पड़ता
है. Okay, so that is all about. Yes, please.
I want to add one more thing. One of my teachers, Dr. Mahesh Sakla, who practices here in Aurangabad, he practices extensively on Borax. Whenever he gets patients of infertility, he usually asks these things, how many number of abortions and all earlier. So before starting treatment for infertility, he makes sure that he gives patient TBP or else viburnum opulus, depending upon what other characteristics he gets. At least for 2 or 3 months, he puts the patient on mother tincture, and after that he starts treatment. So if you read viburnum opulus from Borax, it mentions it will prevent the miscarriages which had happened in the past, and it will prepare the womb for new life or something like that. So he uses either of the two mother tinctures 2 or 3 months straight. Uske baad mein he'll go to whatever medicine is required for, for treating infertility. Is tarah se. One more thing, we most of the times neglect this remedy whenever it comes to renal calculi. But since past some time I've been trying and studying Boger also, from Boger General Analysis and other books also. I never used it for right-sided kidney stone. I had a patient who had this obstinate stone which was not falling off or not going away. It helped. It helped the patient reduce the size. The patient is still on medicines, but Thalapsi Bursa helped.
Yes.
When most of the other medicines failed. So the Boger bolta hai specifically right-sided kidney stone. Think of it.
Yes. Even once I had one case where I had used it. So thank you Vansh bhai, thank you everybody for joining. That's the end of Alphabet B. Alphabet C जब शुरू करने वाले होंगे तो उसका updates आपको Instagram पे दे देंगे. अभी पता नहीं है Alphabet C कौन करने वाला है, because we are going with the flow. This is not a pre-planned program. We are not doing it out of any intention of getting something. So with friends, we will keep discussing with whoever comes up. If anybody has any suggestions of that somebody can come up, or if somebody can suggest somebody's name, please do send it to anybody. Like once you can DM it to once, or you can DM it to me, and
Sure.
we will definitely try and connect with everybody. And thank you so much once again for joining.
I really want to thank you for giving me this chance, giving me this opportunity, especially after Jitesh bhai. It was a lot of pressure over me.
जितेश भाई ने स्टैंडर्ड बहुत ऊपर हाई सेट कर दिया. हम लोग को पता नहीं था कि हम लोग को इतना हाई. Really motivating having Jitesh bhai here. So thank you so much,
Yes,
Atul
yes.
bhai. You are always with us. Thank you, Jitesh bhai, once again. Thank you everybody
I guess.
who has joined. Dr. Poonam, Ranjan Dada को बुलाओ. Yes, रंजन दादा को बुलाएंगे.
अर्घा भाई.
रंजन दादा ने अपने लाइव में लास्ट टाइम बोल दिया, इसलिए सब लोग रंजन दादा को डीएम करो कि रंजन दादा यू हैव टू कम फॉर दिस मैराथन.
रंजन दादा के लिए बड़ा अल्फाबेट सब पैक करके रखना.
हाँ, बड़ा अल्फाबेट सी और एस ही है.
Get the-
So I hope बड़ा अल्फाबेट के लिए
Right.
रंजन दादा. But for that everybody has to DM Ranjan Dada. Don't DM me.
Right,
I can't
right.
convince him. Let us all convince him that he has to come for one marathon session. Okay.
But
Thank you so much.
really thank you, Abhishek bhai. I've been knowing you since almost 2010 or 11 now, and I've been seeing you grow with Master Sir. Your knowledge, Abhishek bhai is so humble enough. If you call him, message him at midnight also, like, "Bhai, ye problem है, इसको क्या करने का है?" Right away he'll give the solution and he'll be like, "Good night." But I really appreciate your humbleness. It really makes me happy. Thank you for this opportunity.
Thank you once for coming. Thank you everybody. See you all next Saturday. Bye bye. Take care. Good night.
Yeah, take care. Bye.